Spring Hill College's nursing division has been ranked yet again as the top Bachelor of Science of Nursing program in the state of Alabama. This comes as RNcareers.org released their 6th annual report saying, quote, Spring Hill College ranked number 1 in Alabama and is one of the best nursing schools in the nation, with an impressive average NCLEX first-time passing rate of 96.78% for the ranking period of the last 3 years. Out of over 1,700 schools examined, Spring Hill College Nursing School ranked number 77 nationally. I got the chance to talk to a current student, an alumni, and the chair of the division to get a deeper look into the prestigious program. All right, today we have the chair of the division, Dr. Kathy Shepard. How are you, Dr. Shepard?
I'm great, thank you.
You have had an impressive career, to say the least. At this point, you have answered 2 callings, one as a nurse and another as a teacher. When did you know that you wanted to become a nurse, and when did you know that you wanted to teach it?
Oh, I knew as a young child that I would be a nurse. In fact, I knew I was going to be a pediatric nurse. I was all about the baby dolls and taking care of them as a young child. And then in my teenage years, I began to want to explore nursing and actually went to work in one of the local nursing homes when I was only 16. So I think it's kind of a lifelong calling that I knew that I was going to do. The part for an educator I kind of fell into. I had an opportunity to teach and decided I would try it. And I've been doing it now for 35 years. So I love teaching. I love nursing. I love the hands-on care. And for much of my career, I have worked during the day for a local institution teaching, but then in the afternoon and evening would go to a local hospital and work to keep my hands in it and to get to play with the children.
That kind of leads us into our next question. Innovation, excellence, and compassion are the hallmarks of the Division of Nursing here at Spring Hill College. Can you elaborate what this means for someone considering to be a nurse?
Well, for us, it means that we want to have excellence in education because we expect to have excellence in the nurses and the hospitals and facilities that we go into. So we want to pour ourselves as educators into our students to give them every opportunity to be the very best that they can be. We give them lots of opportunities to even explore what it is they want to do. We expose them to clinical areas all over the city, different types of nursing, from school health nursing to clinics to standalone emergency clinics to hospitals, of course. And we put them in all the hospitals so that they see the differences and where there may be a unit on one hospital that's not in another. So we try to expose them to the things that they want to do as they are forming their plans for their career. As far as innovation, we're trying to stay on top of everything that's going on around us in terms of the latest operations in the hospitals, the latest equipment they're using, and then we are working on developing a full-blown simulation center to be able to do more of the simulated experience here. But our students do get excellent instruction with going to the hospitals, and then the things like COVID this year was a challenge to many schools and many departments to move online, and it was really not for our department. We polled the students, what did they want? Our students are our number 1 priority. It's all about them. We're not successful if they're not. So they wanted to continue to have class. They wanted to be able to see the instructor, see their peers, even if it was in a Zoom room. Right. So we kept our classes going in a synchronous environment so that they still had the classroom.
Obviously, what you're doing is working because the nursing program is the number 1 4-year nursing institution in the state, a remarkable accolade for the faculty and students of the division. What do you think it is that sets Spring Hill's program apart from other ones in the state and even the country?
Oh, absolutely. I'd love to discuss that. We truly do put our best foot forward with our students. I think it's the fact that we put our students first and what they need. That is the most important thing that we do every day when we come to work, is to look at what we can do to make their education better. And if their education's better, then they become better nurses out in the field. And of course, they're more happy with the program because they can see that the faculty really do care about them. The other really significant piece of that is that our classes are small, so that our faculty actually know the students. Right. We stay in touch with what's going on with them. We're staying on top of their academic achievement, even outside of nursing, looking at the core courses to make sure that they're doing well across the board, to make that well-rounded nurse that we need out in our community.
Some more exciting news for the nursing division. Spring Hill's nursing division recently received a $3.2 million grant for scholarships that would, quote, provide scholarship support for up to 45 nursing majors per year for 5 years, beginning in July 2020, and allow Spring Hill College to help build a diverse workforce while educating professionals to provide health care in medically underserved areas, end quote. How do you think this will benefit the program?
Oh, I think it will definitely benefit the program in terms of bringing in more of our local students, those that need that extra financial support, maybe those that have what we are calling environmental disadvantage. They're coming from families where they don't have parents that graduated from college, and parents maybe not knowing all the ins and outs of college and how to support that young person. So we've got programs within Spring Hill College to meet those needs for our students. So we've got everything from tutors to ACT help. In nursing, we don't even have tutors. Our faculty tutor our students. They come to the faculty and we sit down and go over questions and review material with them as needed. So I think the grant is going to give us more students to actually work with in our community to fill some of these openings for RNs in our area. And of course, students outside of our area can certainly get the award as well. And then we hope that they go back into their communities and work with the medically disadvantaged environments as well.
You are currently visiting high schools to tell potential students about Spring Hill's nursing division. For students who won't get to see you, what is one thing you would like them to know about the program?
Well, first of all, I would like for them to come to campus and let us talk to them. Let them see this beautiful campus and how nice and peaceful, and to see our students and how they love and care about each other and support each other. I think that's something that I can't even adequately describe when I go to the school. So I think them being on campus, and then if they will schedule those meetings, I myself would like to meet with them and talk to them more about our program personally. But if I'm not available, certainly one of the other faculty would be. So we want to reach out to those students when they come and visit campus.
Next, we have Tess Doyle. Tess, who is from Omaha, Nebraska, is a current junior in the program. Nursing is very much a calling, and I'm sure that has been evident to you even as a student. When did you know that you wanted to be a nurse?
Well, I've always sort of been interested in the medical field, sort of for as long as I can remember. I guess I sort of got interested in it first in high school when I started shadowing people in hospitals, and I realized I really had a calling towards nursing. My grandma was also a nurse, so that was sort of a sign that I was headed in the right direction.
As I am sure you're aware, you are currently in a top-ranked program. What do you think it is about Spring Hill's nursing program that sets it apart from so many others in the state and even across the nation?
Well, one thing that has really stood out to me is our amazing clinical instructors. For clinical, we go into hospitals and we work one-on-one with patients just like real nurses. And our clinical instructors are there to guide us and help us learn and teach us. I have had an amazing experience with every single one of my instructors. They are so welcoming in the hospital. They do an amazing job of making me feel confident in what I'm doing and helping me push myself to do better and be a better nurse.
You have been in the program for 2 years now. It is my understanding that you recently went through clinicals. Can you give me a walkthrough of your typical day as a nursing student?
Your typical day as a nursing student is that there is no typical day. At clinical, it depends on what course you're in, but most of the time you show up and you are given a patient, and it is your job to learn everything there is about that patient. So you look up their medication, you look up their medical history, and you try and familiarize yourself as much as possible with their situation and why they're in the hospital. And then we usually review the information with our instructor, and then it is your job to take care of everything that patient needs. So that can include more simple tasks like, giving them a bath or helping them change their bed, helping them get changed, to things like IVs, catheters, and real nursing skills in the hospital.
How was it giving out doses of the COVID-19 vaccine?
It was honestly an amazing experience because we all have been affected by the pandemic. I was here last year when we were sent home in the middle of my Foundations nursing course, it's called Foundations. It's because it's the foundations of nursing. It's everything you need to know. We all missed the end of last year. We all felt unprepared coming back. So to be some of the first people to be able to give out the vaccine and take this step towards ending the pandemic was an amazing experience.
Your senior year is approaching, which means that you are just a step closer to graduation. Do you have any plans to intern in the near future?
Yes, I actually do. I have an internship lined up right now in New Orleans for the summer, and I will be working in the ER, which I'm really excited for. I'm interested in critical care in the future, and I'm definitely going to be pushing myself with this ER internship, but I'm very excited for it.
Next, we have Taylor Stein, a 2019 graduate of Spring Hill College. Taylor is currently an ER trauma nurse at USA Health University Hospital. Taylor, as a current nurse working with trauma, you are living out your calling. When did you decide that you wanted to be a nurse?
It's nothing too crazy of an answer. There's no big moment. I know that that's a pretty commonplace for people who end up going into that industry. But for me, it really boiled down to, I was lucky enough when I was younger to have a group of people, including my parents, mentors and such, that really helped me understand that you need to start having a perspective about your life at a younger age in terms of what do you want for yourself? What do you want to do with yourself? I got lucky in terms that I got the people around me that gave me the chance to understand those things. And what really foundationally came out in my life is I knew that I really wanted to live in a world where I was on my feet. I don't do well sitting down. I don't do well staying stagnant. I do love moving around, being physical, being active. And so I found that in nursing. Also, it really is something that I truly love to be challenged in everything that I do. I take that as, a big motivator for me. And, I knew that working in a field that's always ever changing, where you truly are working around some of the smartest individuals you possibly can be, and being around a lot of different personalities, it makes you change in a lot of ways to adapt to all these different situations, and being able to have that wide knowledge base and work out how to, different scenarios and things like that. That was also a big draw. I also knew that I wanted something a little bit more exciting in my life. Working at the trauma center, you never know what's going to come through the door, and I know that a lot of people say that, but there are times where you'll be sitting down charting, and then a car rolls up, and you just got to start and react and move. So that avenue of that excitement and that adrenaline is something that drew me. But the final piece that really put it all together for me is I knew that I wanted to be in a servant role. Being Catholic and understanding some of those foundational teachings that you receive when you're young, I knew that I wanted to serve my community and serve others. And I knew that it's never an easy role, but it was something that would make me happy. And that's at the end of the day that all I wanted to do is do something that, gave me that fulfillment. If I knew that if I wanted to do something at 110% and be able to do it, to the best of my ability, I knew that I needed to do it being happy and, coming home at the end of the day and really reaching that fulfillment, knowing that at the end of the day, I was happy. So that's really what made me become a nurse, is a multifaceted, basic reasons, but that's kind of the foundational approach to what led me to be a nurse.
The hunt for a job can be difficult at times. What was it like finding a job as a Spring Hill graduate?
It was definitely a tough process. It was very stressful, but I think for a lot of good reasons. My senior year, I got to be a part of an internship program at MD Anderson. It's the #1 cancer institute in the world. I got to be a part of their pediatric intensive care unit. During my time there, I set up great relationships. I eventually was offered a spot at their residency program. I knew pretty immediately that that was going to be an option for me. But I knew that the ICU was probably not the place that I would be happiest. The ICU tailors to a certain personality that I don't think I fit. So I was lucky enough to be offered plenty of residency programs in ICUs, but unfortunately getting into a trauma center, especially as a new grad, is a very uncommon thing. You find that most major trauma centers do residency programs. When you have intensive care residency programs, you have multiple intensive care units. You really only have one trauma center per the hospital, and you only have so many spots. So really, finding a residency program for trauma was difficult. A lot of them closed down or went on hiatus during my time where I would be applying. It was more difficult to find a good residency program for trauma simply because of COVID more than anything. When it came down to it, we do a thing called practicum in our nursing programs. It's where you go work as a nurse for 60 hours. I was lucky enough to get my selection at South Alabama. I had a teacher who, when it came down to opinions and such, I held hers in high regard. I listened to her about just about anything. She really sat down with me and gave me some good advice saying, I really think that South Alabama is a great option. She had worked there prior to becoming a flight nurse, prior to becoming a DNP, Doctor of Nurse Practice. It was a great place that she held in such high regard that I had no other option than to just look at it. And I'm very grateful I did. I ended up interviewing there. The leadership that I work under now really stood out to me in the way that they treated their nurses and such, and the way that they set up the interview process, the experiences they could tell me about and all that such. And not only that, but it was one of the very few opportunities that a new grad can get to work in trauma. So I had no other option but to take it. I would not have gotten that opportunity really anywhere else except for if I went to Spring Hill. I really am thankful for that. The process after graduating was tough, but simply because I received such great training and I was such a well-prepared nurse, I did have, endless opportunities to do a lot of really cool things in a lot of really cool places. And I think that is a very unique thing. You'll see a lot of people who graduate from a big nursing program who don't have the option to go do crazy first-time jobs. And, to work in a trauma center, a level 1 trauma center as a new grad is a very unique thing that I am extremely thankful for. And it's just something that I think I uniquely got the opportunity of because of my connections from Spring Hill.
Last question. Is there anything you would like to say to the student who is thinking about being a nurse and accepting that calling as you did?
I've been a part of so many cool situations where when you look at it, you just can't think of any other option but to be thankful for the hard work that I got to do to get to that point. And it is very daunting. It is very hard, but anybody can make it. I really do believe that, you don't have to be some special individual to be a nurse. You just have to be someone that's willing to accept the responsibility, willing to accept the hard work that you have to do. And if you're willing to do those things, it's going to be a field that offers you endless opportunity. You can go to med school. You can become a medical sales rep. You can go be a nurse practitioner or an anesthesiologist as a CRNA. You can work in a helicopter. You can do business. You can do anything. And so, it's really a profession that just because you start at the bedside doesn't mean you'll end there. Some people get to do incredible things. Right now, I'm trying my hardest to do all the necessary training and get my board certifications to try to be able to become a flight nurse. I have dreams of going to med school, and all that is possible because I decided to take that leap of faith and become a nurse. There's nothing that can't stop you from going back into business, but you will end up, if you want to go be a nurse, you're going to have to go to nursing school. If you want to get into medicine, you're going to have to go through those medical, training programs. So you're really not limiting yourself. I know people who wanted to become teachers. You can still be a teacher as a nurse. You can still educate people. You can still do all of those things. It is truly a profession that you have so many endless opportunities.
Thank you for listening to our podcast. I hope that if you haven't already, you find your calling as well, and perhaps allow Spring Hill College to help you fulfill it. For more information about the nursing division and other majors at Spring Hill College, go to shc.edu.